we'll move on to supportive counseling and what that might look like. Now, supportive counseling is crisis specific, and it includes respectfully listening to them, to our victims, our clients, as they express their feelings, right? Or as they're becoming more comfortable in doing so. And then demonstrating empathy and concern while we're providing all this other types of information. And it's important that we reassure them that all of these responses that they're having, that we talked about, are normal, right? And that they're not crazy and that they're going to recover. Supportive counseling encourages survivors to face their fears in realistically safe situations, right, as soon as possible, and to discuss what happened openly. And, counselors are really going to be able to acknowledge that any resistance, right, to do so is going to be completely normal, and it's understandable. This stuff is difficult. It also includes meeting their personal needs, right, related to the assault. And victims will continuously say that, if you have some sort of emotional support, then, but at the same time, like, their needs aren't being met. Say, yeah, you can be there for me as much, 24 hours, but if my child doesn't have diapers and, I'm not being fed, right, that's not really even going to matter. We need to make sure that their practical needs are being met. And, it's important to recognize too that when survivors see that these practical concerns aren't being met, or they're not important to you, then you may lose that rapport. So being able to help them resolve all these issues are really what's going to be allowing them to make the next steps into healing, right? It's the Maslow's hierarchy of needs. You need to make sure that you have a roof over your head and that you're getting fed and that you can breathe well before you can kind of envision your life in, in recovery or in healing throughout that healing process. So supportive counseling is shown to have significant improvements in things like PTSD symptoms, anxiety, and fear among survivors of sexual assault. And it's been found that cognitive behavioral interventions will lead to better outcomes than like supportive counseling. Now, among the most promising approaches are specialized techniques like stress inoculation. Some of the promising approaches, right? Stress inoculation. This kind of normalizes the fear and avoidance behaviors. And it includes like this psychoeducation along with guided exposure to rape-related phobias. Okay, prolonged exposure therapy includes psychoeducation, right? Breathing training and exposure via retelling the account of the event to address any of the fears and types of avoidance that may be coming up. Cognitive behavioral processing therapy also includes psychoeducation, right? It's an exposure through writing assignments, maybe describing the rape and what that rape meant to that person, and restructuring cognitively to accommodate certain information related to the trauma into pre-existing belief and structures in memory. There's also eye movement desensitization, which involves exposure to a scene that represents the rape trauma. And this is accompanied by a therapist who's kind of moving their finger back and forth. And this kind of helps to relieve some of that anxiety that's related to the scene, and helps to process that memory. And I've heard, there's like EMDR, where I've actually done this. You have like these things in your hands and they buzz, or there's like certain tapping techniques. There's a lot of different approaches to helping survivors of rape throughout the healing process. Something else that that has helped me a lot is NLP, which is neurolinguistic processing. They do things like belief change and emotional release techniques that release things like anger and sadness and guilt and fear. And these techniques are really kind of what can you do right now with the information that you have. In some other like forms, like having a life coach that's specialized in rape trauma can help that person process kind of what's been going on. With NLP, they don't actually have to talk about the rape, right? They don't have to relive that experience. Do they have to go back and revisit that? Yes. But with NLP, they do it through this disassociation aspect where somebody is looking at the scene and they don't have to describe the scene to the person that's doing the NLP. Instead, they just, nod and say, yes, I know what the scene looks like. And then through a process of questions and guidance, they're able to release, integrate, replace some of those existing fears and some of that shame and the beliefs that were created based on what had happened through the assault, right? Through a simple belief change, somebody can integrate new belief systems from an old belief system and to help that person kind of recover and keep moving forward. So there's a lot of different aspects and ways that people can get help, but helping, linking people to these resources can be kind of tricky. So, if the person is open to certain type of counselings, that's great, right? If they're not, then, you might need to work with them in a different area. You can lead a horse to water, right? But you can't make it drink. So that's where some of those other aspects of, developing that rapport, making sure that you're empathetic and supportive, and you're addressing some of that avoidance behavior can really kick in and help people process and make the decision on by themselves, right? Or on their own to actually move forward in the healing process. Now, some of the practical problems that end up coming up post, rape is, if somebody is going in to have a SART completed, or like an exam to collect evidence, having clothes that are ready and prepared for that person to wear afterwards is very important. Something that's comfortable, hasn't been worn before, is just theirs, gives a lot more reassurance and support and really shows physically that you're there for that person. Helping them get cleaned up after the exam, taking a shower, giving them certain, not certain, just giving them things that will help them feel good and feel comfy again. Just nice soaps, face wash, body wipes, deodorant, all those essentials that somebody isn't really thinking about bringing to a rape exam, right? They're in the state of trauma. So just providing these things is going to help. Also explaining what the police report process looks like, what it involves and what it means. And the distinction between what that person tells you and that confidentiality and how that changes when somebody's talking to an investigator or the DA's office, and then also information about obtaining an order of protection, and what that will look like and what somebody will need to do in order to in order to get that. Okay. If they need to, maybe finding a safe place to stay that night, if they need to change the locks on their doors, notifying a bank of theft if that is a concern, obtaining some sort of emergency funds or food and housing. If they have children, figuring out kind of what the logistics are of ensuring that their children are safe and taken care of and being able to transport. Maybe they're at school or they're at a friend's house or something like that, just helping them through that process. Locating a pet or ensuring that it's fed. Providing or finding childcare, addressing certain court issues or concerns around court and what that process might look like. Arranging transportation home or to different appointments. Getting a voicemail service or a telephone, right? Generally we have phones, but sometimes depending on what had happened within that experience, sometimes they don't have that. And so kind of getting them linked. We have these, they call them Obama phones. I don't really know why, probably because it happened within the last 10 years, but there are certain resources that you can utilize, and whatever company that you're working with or whatever nonprofit you're working for will have an idea of what those resources look like. Making referrals to appropriate medical and other community agencies for follow-up. Maybe that looks like mental health, or if somebody's chosen to get the, oh gosh, a PP, I forget what it's called, but it's preventative measure to ensure that your body doesn't develop HIV. You have to go and do a follow-up appointment after that. And then also, if somebody's decided to take contraception or emergency, plan B or something like that, then ensuring that they, sometimes I will set an alarm on their phone for the next day to do it, or I will call or stop by the hotel, depending on where they're located, just to make sure that they're comfortable and they are following through on their on their medical. Dealing with the media, if that's an issue. And then, at the end of it, need to know that they're not alone and that other people are there to support them. Tell victims that the different types of support that you can provide, and also the types of support that you can't provide. You don't want to make false promises to somebody, because, if you do that, it just compounds the trauma. And if somebody's in this state of fight or flight and searching for threats, then you all of a sudden become a threat. And you don't want to do that, because you could be the one person that changes the trajectory of their life and saves them or stops a generational cycle of violence. Like, this is a great opportunity. So it's important that you make sure that they know these things. Also, who and when they can call for help, whether that be a rape crisis center or you. Generally, you want to set a boundary and don't give them your personal cell phone number. I know people have done this, but that's up to the individual. Okay. Also explaining to them what advocacy doesn't mean, right? And advocacy never means that we're going to make decisions for that person. Instead, we'll provide them with the information and resources that they need to make an educated decision. Advocacy also means that we will provide support whether or not they decide to report the incident or not. And what their role is in the future, right? Sexual assault victims often will form a very special bond with the first people who are responding to their needs. If you're going to be available to work with them in the future, right? Letting them know how to reach you or hours that you're available. I know that for the agency that I worked for, I never wanted to say that I will be the next person you see, because There may be another emergency where I am at the hospital with another client or a victim and I can't go and meet them, right? There's these things that come up. So you never want to promise that you will be able to follow through. There's tons of things that can happen, and you just don't want to give any false promises and not be able to follow through on anything. And this is a very special bond, and it should be considered an honor and something that you hold of high value and high professionalism. So, you know, think of this as an opportunity to step in and help somebody, and just be cognizant of your role and what your roles aren't. Okay. Now, regardless of how many times you've been on a SART or you've met with a sexual assault survivor, all of the stories are different and unique, and you could be triggered at any time. You could feel like it's just too much for you. And it's really important that you kind of have an idea of what that looks like for you. So what are the signs that you may need, you know, emotional support, or maybe you need to go to therapy and process some of this secondary trauma? It's not unheard of. That actually, it's absolutely heard of, and we'll have like a lot of time to talk about this later. But secondary post-traumatic stress is a thing, and you know, you want to be aware of that going in and to recognize what your stress signals look like, you know, and it looks different for everybody, but some of the common ones from the top of my head is, you know, having sleepless nights, a lot of the PTSD symptoms really, because it's secondary. So uncontrollable thoughts, you know, behavioral issues, maybe you have a lot more conflicts, nightmares or terrors, reoccurring, like, you know, I know that after I've left somebody, after being with them, you know, you're listening to their story sometimes 3 times, you know, to the police, to the nurse, and maybe to like an investigator or somebody else that's just around, or they may tell you before anybody else gets there. It just depends on the situation. So then when you go home, or when I've gone home, I'm going to bed exhausted, and all I'm doing is replaying this rape scene in my head. And so just be cognizant that this could happen will kind of help you and decide how you're going to deal with it in that moment. And what are your healthy coping skills, you know, versus unhealthy, right? Are you avoiding? Because if you are avoiding, be cognizant of that and step into that, process it, you know, journal about it, talk to your colleagues, a coworker, friends. They're not going to understand. And to be honest, I don't even talk to my husband about this stuff anymore. I found that he is very empathetic, and picks up on energy a lot. So when I'm telling a story about a victim, like, he will have secondary trauma because he's just not used to dealing with these kinds of situations, and he doesn't particularly want to, right? He'll be there for me to cry. And you know, so, like, just thinking about it kind of makes me a little, because this is just a very interesting and unique situation to be in. So just recognizing that it's hard is really important. Okay. And so, you know, also for the victim's sake, you know, you don't want to tire yourself out or get triggered and then not be able to show up for them later. Or every time you see them, you get triggered in some way, right? It's important to process this stuff. So you might want to refer a survivor to another agency, like a mental health agency. So some of the ways to, or some of the things that you want to keep in mind when you want to refer somebody out is if they're actively suicidal, if they are actively psychotic, if they can't function day to day, or, you know, it's normal to kind of be in this state of processing and immediately having these PTSD symptoms, right? But if it's lasting more than a few days, then they need to see somebody. If they are exhibiting like persistent phobias, if they are actively abusing substances, right? And that's seeking behavior and avoidance and trying to get out of it. Or, you know, if they're interested in resolving some long-term issues, then absolutely make that referral. Now, a rape can really be a wake-up call for somebody. So even if you just suspect that any of these are happening, then just go ahead and insist that they see a mental health professional who's really capable of making an assessment, because we're not doctors, right? So, and you know, this is also, it's likely that it's available through your local rape crisis center. I know at One Safe Place here in Reading, we have counselors on site. So there's always somebody that you can talk to, usually within like that hour, right? A psychologist will, or a counselor, therapist will make the time to see somebody if they need to make an assessment. You can also refer out, right? We have Hill Country, and there's also this van, it's like a crisis van, it's like a health van, I forget what they're called. Hill Country has one too, but they can actually come to the client. So say they've gone to the a hotel, you put them up in a hotel for the night. Well, you can actually call them and they will go to the hotel and do an assessment. You can also call a police officer and they will go in and do a mental health check. So there's always a resource or somebody, an agency, social service, you know, legally, whatever, you know, there's always somebody that can step in and assist you, right? And if you ever don't know or you're afraid, there's always, you know, you want to reach out to your supervisor. Okay. Suicide risk. There's an acronym, SLAP, SLAP. Okay. Whenever you suspect that somebody may be suicidal, it's important to like evaluate a little bit further, right? Let them know that you're concerned and explain that you have a responsibility to them to make sure that they get evaluated. The term evaluated can be triggering. So even an assessment can be triggering for somebody, right? You don't, because evaluation and assessment kind of sounds like somebody's going to be judging you. And especially if you're coming out of a sexual assault, you don't want that, right? So you would phrase it differently. You would say like, you know, I would really like to invite somebody else who is trained in mental health to be able to talk to you, and you know, I'll be there with you. I want you to be safe, and it's part of my responsibility to make sure that you're okay, and I hope you're okay with that. Is that okay? And you can just kind of process through them and get them to a state of saying yes. If they don't want to say yes, if they keep saying no, I don't want anybody assessing me, you kind of have to play tough love here and just call somebody anyway. It may feel awkward. They may yell at you. They may say they're never going to trust you again, but you could be saving their life, and that's more important, right? And generally at the end of it all, they're going to look back and say, okay, right, I was in trauma brain. Now I'm looking back on the situation and I recognize that you did what you had to do. And then that actually creates more trust, and that you have a strong backbone and you're going to do what you have to do in order to make sure that they're safe. So then that actually increases their trust, even though for that short period of time, it could be very disruptive, or it could feel disruptive. Okay. So criteria for suicide risk. Okay, if they've stated suicidal intent, if they've made a choice about how they're going to do it, right? Lethality, their lethal method, if they have access to this method, and if they have a plan of action. So you can use the SLAP acronym to remember this criteria. S, statement of suicidal intent. L, lethal. A, access. P, plan. If these are present, then you must seek professional help immediately on their behalf. You can inform them that you have an obligation to call 911, and you can even ask for a police to transport that person to a mental health assessment center for evaluation. I have had clients just call on their own, right? After me going through it and saying, you know, let's get you linked to this person. Sometimes they have gone through this before, so they kind of know the steps, and, you know, they know what they need to do in order to seek help. So just be on standby with them as they're going through this process. Yeah, it doesn't happen a lot, but if it does happen, it's good to know. Let this seep into your subconscious. Don't get super afraid, right? You just do the best with the information you have at the time and the skill set that you have. And if you ever get nervous, call superior. Okay, it's okay. Everything's gonna be fine. Don't freak out. Another thing is psychosis. Okay. So if a victim seems like they're psychotic, then we'll need to determine if they're oriented, right, to person, place, and time. So you can do this by asking them, what's your name? You know, do you know where you are right now? What time is it? What day of the week is it? What is today's date? Okay. If you think that they may be hearing voices, you can just ask them, are there any voices, or can you hear voices that maybe I can't hear? Confusion can be caused to a number of different factors, right? Head trauma, alcohol or drug intoxication, or other types of psychosis. Whatever the cause, we must refer them, if they appear to be psychotic, to a professional who can definitely determine their ability to care for themselves. The last thing you want to do is take somebody who is come from a sexual assault, extremely traumatizing, put them in a room by themselves in a foreign area where they don't know and nobody else knows where they are, okay, and then leave them there. Okay. So, you know, you want to find out if they are considered capable of self-harm. You know, get that assessment. If you're meeting somebody somewhere other than a medical facility, like on site or at an investigation office, like a police department, it may be necessary to ask them to put that person on hold, so that they can go ahead and be medically maybe checked into a psychiatric facility for further evaluation. If the victim will go willingly with a responsible adult, right, who's willing to assume that responsibility, you don't need to bother involving the police. Okay. Police can also be triggering, so if you don't have to involve them, don't. So there's also concerns about substance abuse. And as we know, and we'll talk about complex traumas, and, you know, there's a big question of what happened first. Did the substance abuse happen first? Did the violence happen first, right? Did the mental illness happen first, right? It's kind of like a big cycle, okay? If you've got substance abuse, then you may be avoiding the violence, and that can make you mentally ill. You could be mentally ill and be self-medicating using substance abuse, and that made you vulnerable to violence. You could have a violence happen to you, and then, you know, use substances, and that led to mental illness. Violence could cause mental illness that leads to substance abuse, right? So it's often seen, you know, if somebody doesn't have a stable lifestyle, say they don't have a home, they're living outside, this isn't uncommon. And this is one of those, you know, pivotal moments sometimes where they decide, okay, like, I'm done. I don't want to be on the streets anymore. This was a huge wake-up call, and you get to be there to maybe check them into a rehab facility so that they can go ahead and get you know, mental illness checked out, and then help with substance abuse. If somebody's mental health isn't taken care of, then it's going to be really difficult to get them to either leave an abusive relationship or stop making themselves vulnerable to sexual assault. So some of the things to be concerned about are if drugs or alcohol were involved, if they come to a counseling session and they're already intoxicated, if they report that they've been increasing their substance abuse, if they're concerned about it themselves, or if they've made reports that like their friends or family are concerned about their substance abuse. So in other instances that you might want to ask for help or refer somebody out, particularly situations in which you feel you are unable to provide the necessary support, right? Some of these circumstances may fit into categories like if an assault was very similar to something that you experienced yourself. If there's this personality clash with the victim or their family, okay? If their needs are beyond what you can provide, or if you or they have a difficulty maintaining healthy boundaries, okay? I'm trying to think of, you know, what could this look like? If an assault did seem very similar to something that you experienced yourself, you may want to just break all those barriers or break all those boundaries that we try to hammer into you, like don't give the client your home address, don't go spend your own money to, you know, buy them car or something like that, right? There are certain boundaries that you have to have in place in order to help somebody. It's almost like you have to be kind of disassociated or a little bit clinical when you're moving through and helping people process this trauma, so as to it doesn't affect your ability to help other victims, right? Or help yourself, because if your cup is not full, you cannot help other people. We'll get into self-care a little bit later towards the end of the program. So review of the learning objective, right? Between last class and this one, you will be able to use crisis intervention, education, and supportive counseling skills to assist sexual assault victims. So congratulations. If you have any questions or comments, please feel free to reach out. I am trying to make myself available as possible. You can email me, reply in the comments, all the things. So congratulations on completing this. I hope that you feel a lot more secure in your ability to handle sexual assault. It can be really scary at first, and that's completely normal. And just know that you have support. You're not alone in processing this, and you know, people do this for life, right? This is something that I have found is incredibly important in our communities. And if there's anything that I can do to help you become a better advocate for yourself, for survivors, please let me know, and I would love to help you.